In this section, we are talking about the ecologic study. So first of all, let's look at the concepts of ecologic study. The ecologic study is an investigation of the distribution of health and its determinants between groups of individuals. If we only look at the concepts or definition of the ecologic study, it's quite similar to the cross-sectional study, but actually the most important, the difference is that the ecologic study only use the data from the entire populations, but not individual data. So, which means we can only see a trend between the entire populations. And we usually use the ecologic study to offer clues for the cause of a disease, to help evaluate the effects of interventions or field trials. And it can also use to apply for disease surveillance. So let's look at these figures about the cigarette consumption in 1930, the male lung cancer death rate in 1950 in some selected countries. So as we can see, the x-axis are cigarette consumption per capita in 1930, and the y-axis is the lung cancer deaths per million persons in 1950. So as we can see, as the cigarette consumption increase, the lung cancer deaths also increase. So there is a linear association between a positive linear regression between the cigarette consumption and the lung cancer deaths. So based on this study result, we can have clues that maybe the cigarette consumption is a risk factor for lung cancer deaths, which now we are knowing that this is a fact. But in the early time, we only have these clues. And this figure shows the cardiovascular disease deaths and the potential relationship with smoking prevalence. The yellow lines with dots indicate the smoking prevalence, while the white lines indicate the cardiovascular disease deaths, and the x-axis indicate the years. So as we can see, the smoking prevalences are decreasing, as same as the white lines, which indicate the cardiovascular disease deaths. So these figures give us a clue that cardiovascular disease, when smoking prevalence decrease, the cardiovascular disease deaths also decrease. So this indicates that there are potential positive association between the smoking prevalence and the cardiovascular disease deaths.